over my notes briefly. I think the overall thing from this afternoon is really about thinking about the language we choose to use. And I mean that broadly speaking. So whether we fall on habitual words like fine, okay, sure, fine, whatever, in that respect. Also, how we present certain things. So I talked about in the postnatal case, a bit heavy-handed with some of the language about how drinking would affect my daughter, not necessarily needed to be so heavy-handed with that. So thinking about the teenage case, thinking about keeping the language simple, positive, encouraging, and again going to this last case when we think about having something else, if you can't offer the patient what they want, having something else, and then how you present that. So the language you use and the presentation of that language were the key things from today. So that finding that energy, the last two cases I think I've mentioned about connecting with what you're saying. So although I didn't see what your name was, Divya, is it? Was saying, like, just that beautiful empathy and lovely pacing. What was required right at the end there was more more of an energy, and in the previous case, connecting when someone's saying to you they're terrified, really your tone should change, so you're responding to your patient's emotions almost. Obviously you've got to stay professional, but I think with this group you can afford to feel it a little bit more and then present it therefore a little bit better. They were the only other things. Signposting, again, I forgot to mention after the first case, actually, signposting came after the event when you were asking me about blood clots. So again, thinking about signposting, make sure that's done before you go on to ask questions that might alarm a patient. Be clear is what I've put. Yeah, again, going back to language, who is a social prescriber to a patient? They don't know who that is. So about presentation and language used, I think, is the language we choose, and thinking about who you're talking to as well, be it child, teenager, whoever. But yeah, there will be my key things to think about. But as Nigel says, really strong group, and I wish you all the very best of luck.
Thank you so much, Louise, and we'll catch you soon. All right, take care. See you later.